Welcome to the video for the Anatomy and Physiology Lab at Westchester Community College. My name is Wilson. This will be the video to identify the veins of the blood vessel model. First, we have the cephalic vein. This here is the cephalic vein. Next, we have the basilic vein. This entire vessel is the basilic vein. Then connecting the two, here we have the median cubital vein. Median cubital vein. Then as we continue here, once we get to the armpit region, we have the axillary vein. And then as we go further, now we have the subclavian vein. So here we have our right subclavian vein. Here we would have that left subclavian vein. Next, we have our internal jugular, our right and left internal jugular veins. And although it's difficult to see, but when the subclavian and the internal jugular merge together, this creates the Brachiocephalic vein. But it is easier seen right here. This is the left Brachiocephalic vein. When the Brachiocephalic veins merge together, they create the superior vena cava. Superior vena cava. Next, we have in red, we have the pulmonary veins on both sides. Pulmonary veins. And now we can continue all the way to the bottom of the model. First, we have the small saphenous vein. The small saphenous vein. Next, this entire vessel is the great saphenous vein. The great saphenous vein. Here we have now the deep femoral vein. The deep femoral vein. And this vessel is the femoral vein. Femoral vein. As we continue up, this entire vessel here is the external iliac vein. External iliac vein. And although it's slightly cut off, this here is the internal iliac vein. The internal iliac vein. The external iliac and the internal iliac will merge together to make the common iliac vein. Here we have the common iliac vein. And then these two vessels will merge together to make the inferior vena cava. Inferior vena cava. Next, on the sides here, we have the renal vein. Renal vein. And then here where we have the liver, we have the hepatic veins. Hepatic veins. Lastly, we're going to cover the vessels in purple. This is the hepatic portal system. First, we will cover the superior mesenteric vein. This here is the superior mesenteric vein. And although most of it is cut off, this cut off vessel here is the inferior mesenteric vein. Inferior mesenteric vein. Next, this here is the spleen. So this here is the splenic vein. The splenic vein. And then lastly, the superior mesenteric vein will merge with the splenic vein to make the hepatic portal vein, the hepatic portal vein. Thank you for watching.